This is a case of right vocal cord cyst planned for laser microlaryngeal surgery. Here, infiltration is given into the right vocal fold with saline. Saline causes separation of the cyst from the vocal ligament, and saline inside the vocal fold will absorb the energy from the laser and prevents injury to the vocal ligament. Here, now the mucosal cuts are given with CO2 laser. And the cyst is gently separated from the vocal ligament. You can see that the cyst is ruptured and the fluid from the cyst is cleared with the swab. The remaining walls of the cyst should be gently separated from the vocal ligament and from the vocal fold mucosa. Most of the times these cysts are very friable and they rupture during surgery, but the whole idea of the surgery is to remove the complete cyst wall. If you leave behind part of the cyst wall, that will again cause recurrence of the cyst. So with the help of CO2 laser, we are gently separating the cyst wall from the mucosa and from the vocal ligament. This is done sequentially. Laser cuts are given separating the wall of the cyst from the vocal fold mucosa. The advantage of laser is there won't be any bleeding and you can dissect the tissues layer by layer and you get a precise cut. There won't be any lateral damage to the tissue. So the ultimate voice outcome is better with the laser. So in this way, gently the cyst wall is separated and make sure we don't leave behind any cyst wall to prevent recurrence. So sometimes it will be difficult to separate the cyst wall from the mucosa, as the mucosa is a very thin layer. In these cases, we resect part of the mucosa along with the cyst wall so that we don't leave behind any cyst wall. This reduces the chance of any recurrence. And the defect is generally heals well and there won't be any change in the voice post-surgery. So part of the mucosa is being removed along with the cyst wall, the last part. So, and that is the defect after completion of surgery. Since the vocal ligament is not damaged, it will heal with the second intention and the scarring will be less, and the post-op voice results are far superior. Patients are advised voice rest for 1 week, and they can start speaking after 1 week, but we advise them not to speak for prolonged periods and not to shout, and they have to avoid spicy foods for 1 month to prevent any acid reflux. So these patients are suggested to undergo speech therapy after 2 months after completion of surgery.